one.
Okay, thanks for joining us. You will notice that we are wearing our masks today because that is the new guidance from the CDC. When you are in a public place, you should be wearing a mask. So while we're speaking, we're going to take our masks off. But that is the rule right now for county buildings. If you come in as a visitor or as an employee and you're in a public space, we're going to ask that you wear masks. So just an update on some of the statewide information. There have been over 5,400 deaths in New York State at this time. Across the United States, we've had 11,700 deaths. This is a serious thing, and we are right to have taken it seriously from the beginning, which we have here in Lewis County, and we're proud of the residents that have stepped up to take it seriously as well. In New York State, we're starting to see that the hospitalization rate is stabilizing a little bit. Over the last 3 days, it hasn't been increasing at such a dramatic level. That might be indication that at least downstate area is reaching a type of plateau. But that doesn't necessarily mean that Lewis County in the North Country has reached our plateau. If you look at the numbers and you look at the map, it's kind of worked its way up I-87, through Interstate 90, up 81. So it will get to us. There's no way to tell when exactly that will be, when we'll reach our peak, but we need to keep being vigilant and doing the right things, the social distancing. The state has extended their Pause New York executive order to April 29th. That means businesses and schools will remain closed through April 29th at least. They have also increased the fine for violating the executive orders. It was $500, now the fine is $1,000. In Lewis County, we've really been on a bit of an honor system. We know people are in tough time with their businesses, but we also have to take our public health seriously. And so we are very thankful for all those businesses who have complied and done the right thing with the social distancing measures right now. We mentioned the mask and our mask policy. In Lewis County, like we said, our numbers have been fairly stable. Ashley, can you run us through some of the numbers from today, please?
Yep. So to date, we have 95 individuals under quarantine. We have 7 in isolation. So one of our confirmed cases has recovered and is no longer in isolation. We've tested a total of 159 people. 120 of those have been negative results, and we have 31 pending results as of today.
Wonderful. So one of the things we've gotten a lot of questions about was on Sunday when we had our round of 4 positives come back all at once. We did issue some guidance about some public places where those folks had been. You probably saw that we were encouraging people who were at Walmart on March 27th from 6:30 to 6:45 p.m. and people that were at Tractor Supply on the 28th from 9:30 to 10:40 a.m. We were asking them to call in to the county and receive further guidance from our public health department. Ashley, can you explain a little bit about that process and what those people would have experienced if they called into our line?
Yep. So we did put out the press release and encourage individuals to call. When they call, they receive a recording that further reiterates that they needed to fall within the time frames of being at Walmart or a Tractor Supply that we put out in the press release. That we stated that again on the line, and that we would get back to them to discuss quarantine procedures when we checked the voicemail. So we have been doing that. We have received about 80 calls to that, and we've quarantined a good number of those individuals. And this exposure risk was low, but this is a good public health measure and extra precaution to take to quarantine these individuals for the low risk that they were potentially exposed.
Great, thanks. Another issue that created a little bit of confusion, a lot of questions in the community, was the governor's executive order, or at least an announcement that was made late last week about hospitals in upstate sharing resources downstate. Jerry Kerr our hospital CEO, is gonna talk a little bit about what that looks like and the work he's been doing with the Hospital Association of New York.
Thank you, Ryan. Let me start off by just simply acknowledging that under very difficult and trying circumstances, Governor Cuomo and Commissioner Dr. Zucker and their respective teams are doing a remarkable job leading and organizing the state's response. Their focus on supporting hotspot communities while driving a united New York State plan is crucial to flattening the curve on a virus that does not respect intrastate county boundaries. So I think we really do need to address our hotspot communities, but we also need to be part of a broader solution to support all residents and citizens and visitors to New York State. So I'm very proud and pleased to be part of that. It's worth noting that we have not received an executive order from the governor. And I think in large part, I would commend the work of Haney's, the Hospital Association of New York State, and its member hospitals, and Lewis County Health System is one of those. Coming together and rethinking how ventilators could be available to hospitals in significant need. So we've previously reported to the Department of Health that we could have 12 ventilators. We do have 12 ventilators at LCGH. And if we were not using them all, could we set some aside that would be part of a pool of ventilators that could be utilized elsewhere? A fundamental difference from what was reported last week and what's evolved this week is the ventilators we have identified, which are 3, stay in Lowville. And if there is a need, then there is this center that will reach out to us to say, Hospital X is in need. Do you still have one of those 3 ventilators available? And there is this whole tracking process. It's called geo-coded, so we would know exactly where the Lewis County ventilator would end up. The beauty of this plan is if we got into a dire situation, we could call this command center saying, we need a ventilator here, we are all out. And then other hospitals that have put forward voluntarily ventilators that could be available would then be sent to us. So I think it's a great illustration of a sharing program that's driven by hospitals volunteering to work together to be available to each other throughout the state. It is worth noting that as of 10 o'clock this morning, there were already 300 ventilators identified in this manner, but pooled across the state, not in a single warehouse, if you will, a single stockpile. So I'm very pleased. We're prepared to be part of the solution, and I am also very comfortable that if there is a need on our end, someone will respond to our need.
Great, thanks, Jerry. Anything else you want to add on the hospital?
I guess from an update point of view, the hospital is still seeing regular patients able to perform, all of the things that the community has expected us to do. And those things are still available. There are a couple of exceptions, One would be elective surgery. Okay, none of us are doing that sort of thing. But we're still doing imaging studies, we're still drawing labs, we're still doing PT/OT. Our physician practices are open. But we do recognize that some of our community members are feeling skittish about coming to the hospital these days. So we have, created 2 opportunities where people can receive care without having to come into the hospital proper. One of those is starting on either Wednesday or Thursday, and I don't have that date yet, but we'll be sending an announcement out shortly. You can come for your labs, and we have a separate entrance or access point where you can access a phlebotomist who can draw your labs without ever having to come into the hospital. And then we will be providing the same service for OB visits so that we can ensure the women of our community who are pregnant are receiving regular prenatal care and not putting it off because they're afraid to come into the building. It's also worth noting we were one of the first hospitals in the region to begin taking temperatures of every single person who comes in. We continue to do that. Every single person, visitor or employee, is screened before coming on campus, and if they are showing a temperature of 100 degrees or greater, then they're not allowed into the hospital. And the other thing we are doing is every single person who visits us, once the screening is completed, they're receiving an isolation mask. So 100% of the time, and visitors' employees are wearing their mask during their time at the hospital. And it doesn't matter what your job is or why you're at the hospital. Thank you.
Excellent. So one of the biggest challenges right now is that we're into day 30 of this social distancing experiment, and it seems to be working, but it is so important that we stay connected to one another in the community, especially in the community like Lewis County, where we are so connected and we rely and depend on each other on a day-to-day basis. So 2 new initiatives that we're rolling out today. The first is called the Take 5 initiative, and it's a simple concept. Take 5 minutes every day to talk to a loved one, talk to a neighbor, talk to someone who might be isolated, who's on their own, who hasn't had a lot of social interaction. 5 minutes every day, talk to that person, pick up the phone, FaceTime, and call somebody. Ask them how they're doing. Ask them if they're obeying social distancing and how, what effect that's had on them. Tell them how you're doing and share how your experience has been through this social distancing experiment so far. That connection is so important, and it's a very simple initiative, so we're asking residents to take 5 every day, 5 minutes, call somebody who's close to you, or a neighbor, or somebody who might be in isolation by themselves. Brighten their day and make that human connection that we're all missing right now. The second thing is we want to make everyone aware of a great tool through the State Office of Mental Health. It's called the Emotional Support Line. It is a free and confidential support line for people that have, in this time, some heightened anxiety, heightened depression, loneliness. It is staffed by trained mental health professionals. They are also trained in crisis management, but it doesn't have to be a crisis. It's okay to say that I need a little extra help. I'm feeling some anxiety. I'm not feeling myself in this, these uncertain times, and you're lonely or having a little anxiety or depression. It's okay to reach out, and there will be someone on this line 7 days a week from 8 a.m. to 10 p.m. that will talk to you. That is a trained professional that can help you through some of these issues. The number for the emotional support line is 1-844-863-9314. And really, anybody, we encourage everybody, if you're feeling a little off, give this a try. It's free, it's available to you, and it's a wonderful, wonderful resource. So Take 5 and the emotional support line, 2 important things. Other than that, we will take questions from you guys.
Ashley, with the recovery, there's one person who's recovered. How do you know for sure they still don't have the virus? Is it based on symptoms, or is there a test?
It's based on symptoms. So an individual needs to be at least 7 days from the start of their symptoms. They need to be 72 hours without a fever, and that is without using fever-reducing medication, as well as improvement in their other symptoms.
Is there a chance that because they're asymptomatic, like before you have the virus, asymptomatic, you can still transmit it? Is there still a chance for that after the symptoms have appeared to go away?
So this is based on CDC guidance. So they've done, studies on cases to date. So they have shown that these guidelines are proven to be the most common, and these individuals are not likely to be contagious. They're not contagious.
Can you kind of explain the discrepancy with the numbers that are reported through the New York State COVID-19 tracker and what the county's reporting? I know when people look online at the state reporting, it says there's 6 cases in Lewis County. That was as of April 5th's data, and we haven't added any cases in a few days. So was wondering what the discrepancy is between the 6 that they're reporting and the 8 that you're reporting.
So I can tell you how we get our numbers. So test results are reported to the county that the address on the lab sample is associated with. So if it's a Lewis County resident, even if they were tested somewhere else throughout the state, we would be notified of those results, and we have been, and those are the numbers that we are reporting. Same goes for individuals that are tested here. The results go to the county in which they live in. So my numbers are accurate, and the state may have a mistake, and I have reached out to them to try to clarify.
Okay, thank you. And as far as, I know you're sick of this question, and it's something that we're still getting a ton of. So if you're still in the position where you're refusing to disclose the locations by town or geographic region or anything like that, could you at least let people know, are you noticing that the 8 cases are all coming from like a similar location, or is it kind of more spread out throughout the whole county?
Spread out throughout the whole county.
Okay, thank you.
Yep.
So it might be worth reiterating, Nick, what we said last Friday, which is that at this point, everyone should be assuming that the virus is in their community. It's not safer in Copenhagen than Krogan. It's not safer in Port Lyden than Lions Falls. Everybody needs to be taking precautions everywhere you go. That's the only way to keep yourself safe and to keep your family safe.
And just so people understand, can you kind of go through the progression of the virus a little bit? Like how, so we've been practicing social distancing. I think it actually started around March 15th with the governor's order. And then, so I know we kind of see a lag time. So there's kind of like a 14-day incubation period. So I didn't know if you could just kind of explain that a little bit to people, how the virus just kind of progresses along. At what point are you seeing, not specifically here maybe, but just with the guidance that you have, when do you start to see hospitalizations? When do you start to see the need for ICU beds, things like that, in relation to the progression of somebody that's infected?
So an individual, I'm not understanding your question. In regard to our community, when would we expect to see an increase in hospitalizations? And
no, just somebody, so people understand like their exposure. So if you could kind of just explain that, you know, if they start seeing symptoms today, maybe they were exposed, 14 days ago, potentially. And then kind of how you might start out with milder symptoms, and there's kind of like looking at some information and data from the CDC, just kind of like your 75% rate don't need hospitalization at all, and the rates that do need hospitalization, just kind of giving people a better picture of.
Right. So the level of severity of illness ranges greatly. 80% of the individuals self-resolve and don't require any kind of higher level of care. 20% of those individuals may need a higher level of care, and an even smaller percentage, I think we're about 2 to 3%, would require an ICU level of care. So it all depends on the person. It depends on their immune system, underlying health conditions, their age, but the incubation period is up to 14 days. Hence the reason we have individuals in quarantine who have been exposed to a positive case for those full 14 days. And it's important to note too, people are asymptomatic and wanting to be tested because they were in contact with a positive case. If we test those individuals, they still need to ride out their 14-day quarantine, because just because they're negative this week doesn't mean they're not going to be positive next week. So it's important to note that as well.
And have you been able to expand testing any at all, or do you have the capabilities to do that, or is it still kind of focused on only testing people with symptoms or who have had contact with people?
We're doing a great job. We've increased testing quite a bit, and we are testing just symptomatic people at this point. The state is developing other guidance in regard to testing more individuals. That was released in the governor's press release today. So once we have that and we have the ability, we would look at expanding more.
But at this point, you haven't had any issues getting supplies or what you need to carry out the tests that you want to perform?
At this point, no.
Okay.
No.
Jerry? Sorry, you go ahead.
Good, that's good. Mr. Carr, I had a question for you. Talking back about the ventilators, the voluntary ventilator redistribution that the Healthcare Association of New York State is doing, that's quite a change from an executive order taking 20%. I guess, how do you feel about that change moving more towards a voluntary system?
I didn't have an issue with what was announced last week because I never viewed it as a police takeover of our ventilators. Earlier in the week, we had provided data to the DOH around our inventory, not only of ventilators, but of PPE equipment, to include N95s and masks, all sorts of things. And based on what we were reporting, both in that inventory and based on the daily reports we have to submit for who we're treating, number of COVID positive patients we're treating, I thought there was a reasonable approach to figuring out the 20%. I think there were some who just jumped to some conclusions, and I think the open line of communication between the administration and Haney's allowed people to sit at a table who all have good intentions to work through that. So it's always, I think, more palatable if you can use the word voluntary. And but at the end of the day, we ended up at the same place. And probably the thing that's more comforting for community hospitals is that there aren't going to be 300 to 500 ventilators sitting in a warehouse someplace in New York State, but rather these smaller nucleus of inventories will be in individual hospitals scattered throughout the state. And frankly, I think will make it easier if a hospital in Watertown or maybe Syracuse got into trouble for us to get that piece of equipment to them and vice versa.
Okay, and so you mentioned that there's going to be a center or centers. Is that working? Haney's has centers they're establishing? Or?
No, it's it'll be a something that's staffed by the Department of Health, and I don't know if I've received the exact name, but it's how it was referred to in a conference call earlier this morning was the Hospital Capacity Call Center, and it's basically a one-call stop. So if as the local hospital we need a ventilator, or we're running out of masks or shields, whatever or even staff, this one call stop approach will help guide us to where we could get those resources. From Lewis County perspective, it's hard for me to envision having to tap into it from a need perspective, because our team has really done a great job, working with county EMS and Ashley over at Public Health to clearly identify what we think the need is. We understand the burn rate and placing orders spread out over time. But if we do need something, this is the place we would call, or other hospitals would call if we could help them.
So if something was needed from Lewis County, this hotline would also call you and say, hey, can we...
Around the ventilators at this point. What I have found interesting, there's been very little conversation since last week around PPEs, though we have reported that information, thoughtfully and honestly. But I think from the federal level and some of the other relationships that the governor and commissioner have developed, we do have equipment and PPEs coming into the state. So from what I'm gathering, that the need for PPEs, particularly in the greater New York City metro region, is high, and there are PPEs coming in. So at this point, most of the conversation has been focused on the ventilators.
Sure.
Yeah.
And you mentioned you have 12 total, Lewis County.
12 when you consider the splicing capacity. So there are 2 units that fit the criteria to be spliced,
To split, like have
Yeah.
2 lines.
to serve 2 patients. Correct.
Okay, and you set aside 3 that if they were needed somewhere else in the state, there's 3 that would be able to be called upon and deployed.
Correct.
Okay.
Now, on any given day, it could be more than 3. So the question might be, well, how did you decide it was 3 for the small stockpile, if you will, and then 9 for the rest of our building? And that was really driven by the number of ICU beds we have and the number of beds we have in negative pressure rooms. So that was the math that we used. But we've been fortunate. We've had only 2 inpatients. No one has had to be ventilated. And if that continues, could more than 3 be available? It would not be outside the realm of consideration.
With that, originally, I know you just said this, but there were 6 originally, and then splicing, but they can't all be spliced. So how did we get to 12?
So how we got to 12 is the criteria for what was to be counted changed. So we have 3 anesthesia machines that support our operating rooms. So that was thrown into the inventory count. So there's 3. We had a unit that had parts that were missing. We were able to find and order the parts, and they have been received. So we're able to add another one. And then we have 2 transport ventilators and 2 BiPAP machines. So some of them are less appropriate for COVID patients, and I'm not an expert in ventilators and that sort of thing, but the transport ventilators have utility, but would not be appropriate for someone in full-blown respiratory distress. But they are part of our pool.
Right.
Correct.
Okay.
Yeah, and kudos to the team. People worked hard to get the parts to bring another one to life, and to learn how to create that splicing to go from 1 to 2. So a lot of people did some good work at the hospital.
Ryan, thank you. Ryan, with the OB clinic that you mentioned, that will be to check, to provide, or no, sorry, Jerry, that was you.
Yeah.
I don't think you want me to comment on OB clinics.
Actually, yeah, I absolutely take that back.
The long reach of county government. A little too far.
There's so many things to say. So many. Jerry, so with that, you mentioned that, so for regular stops and lab work, that makes sense, they're going to do it right at the car. I am a little confused how that model will work for OB.
Yep. There are certain visits in the prenatal cycle of visits or schedule of visits that don't require an examination.
No portable stirrups.
No,
That's
it's a check-in. There's the capacity to bring some urine so that lab can be processed. Engage with the mother and that sort of thing. So there are visits that will be appropriate for this. So it isn't the end-all be-all around the OB visit, but not all visits during the term of pregnancy are at the same level of engagement. So for those that are lesser, it is still important for mom to check with doctor and have a conversation about how things are going. It's like telemedicine, right? There is something, and we're bringing more of that online as I sit here with you today. There are some visits very appropriate for telemedicine. So we continue to keep the engagement with the physician. And I view this sort of drive-in approach for OB visits as an opportunity to view it that way.
I'll start this one with Ryan, but I know all 3 of you are members of the Lewis County community. So was just curious to see what your impression of are you satisfied with the way people are practicing social distancing? I know the governor came out in his press conference yesterday, increased the fine from $500 to $1,000 if you're found to be violating. Encourage communities to do better enforcement of that. So just kind of wanted your overall opinion on where you think our community is at, and are you happy with the participation rate you're seeing?
I think our community is doing wonderful with the social distancing. I think everyone is taking it seriously. I am so proud of the Amish community that have been wonderful participants with us on this, this community project to keep everybody safe. I think our community has done a really good job, with one exception. We still have a lot of people running our trail system up on Tug Hill. One, the trail system is not open, so they should not be on the trails. Two, we're seeing a lot of, not a lot, but some congregation in some of the parking areas, those types of things. It's good to get out. We want people to get outside. I think it's good for your mental health to get outside. But when you are gathering with large groups of wheelers, side by sides, that is when we cross the line. And so those folks that are doing those activities, please stop. We don't need that
Will there be any
happening right
enforcement?
now. It's a question for the sheriff.
Okay, and for Ashley, I was just wondering if you could talk a little bit about, with Lewis County being a smaller county, it looks like we're in a better position right now where we're doing more of the contact tracing and things like that, which some of the bigger areas that have a lot more cases aren't able to do. So can you tell us the importance of that and kind of what the difference is between like mitigation and containment?
Yep, so the importance is to obviously stop and slow the spread of the virus. So identifying individuals who may be at risk for developing the virus due to contact or potential contact with a positive case. We don't always know that there definitely was contact, but anybody who we think potentially could have been in contact, we would quarantine. We in Lewis County do err on the side of caution, and it's important, again, to slow the spread of the virus. So
Okay.
we are still containing the virus as best we can.
Okay, and a lot of the graphs and data that we're seeing from the CDC and other places, when you're looking at the prediction of the curves and things like that, it takes into account full mitigation through May 30th. So do you foresee that full mitigation, meaning no large gatherings, things like that, do you foresee that that is going to be the case through May 30th?
I really can't say exactly what date that's going to end. I do know that we need to remain diligent in this, not let our guard down just because, say our cases stop here. I'm not anticipating that that is the case. We're still on the rise, but it's important once we do start to go on the downhill slope that we continue to do social distancing. It's very important. And as far as exactly when we restart schools and open up businesses, that will be a decision that we make in collaboration with the state.
But it's safe to say with seeing the New York City area, it's still a little too early to say, but starting to plateau at this point, kind of get it even out day by day over the last 3 or 4 days. Is it safe for people to assume that a lot of that is because of social distancing? So
Yes.
just because you start going down the other end of the curve, if you pull back social distancing at that point, you're just going to see it.
Absolutely.
Go
You'll
the
see
other way
another
again.
spike. So it's
Okay.
very important that we continue to perform social distancing.
Thank you.
Yeah.
Okay, thanks guys.
Thank you.